Have you noticed small but concerning changes in a loved one over the past year? Many assume aging and death come suddenly, but in reality, the body often gives subtle warnings months or even a year in advance. The issue is that these signs seem minor at first, so families overlook them, only realizing later that the clues were there all along. By then, it may be too late to prepare or create meaningful final memories. In this video, we'll discuss 5 key signs that often appear in the year before an elderly person passes. Some may seem like typical aging, while others indicate a deeper decline. Recognizing them early allows you to provide better care, cherish important moments, and ensure your loved one's final stage is filled with dignity and comfort. Stay with us until the end. Understanding these signs can help you prepare both emotionally and practically. Let's begin. 1. Significant weight loss. One of the earliest signs that someone may be in their final year is unexplained weight loss. It may start subtly: looser clothing, a smaller appetite, or a belt-needing adjustment. Many dismiss this as normal aging, but unintentional weight loss is often a red flag. It suggests the body isn't absorbing nutrients efficiently. Muscles are weakening, and essential functions are slowing. While some muscle loss is natural with age, rapid decline points to deeper issues. The digestive system may struggle to process food, or the body may fail to use protein properly, leading to muscle wasting. This weakness doesn't just affect movement. It increases fall risks, lowers immunity, and heightens vulnerability to infections. Another cause of weight loss is appetite changes. Many elderly individuals experience a diminished sense of taste, lose interest in food, and begin skipping meals. This isn't just preference, it's a physiological shift. As the body slows down, it sends fewer hunger signals to the brain. The result? Less energy, declining strength, and worsening overall health. Additionally, weight loss can signal underlying conditions like cancer, heart failure, or kidney disease, often developing long before more obvious symptoms arise. Even conditions like depression or cognitive decline can contribute to reduced eating, creating a cycle where the body isn't getting enough nourishment to sustain itself. Families often try to help by offering favorite foods or supplementing meals with protein drinks. However, if weight continues to drop despite these efforts, it's crucial to recognize that this isn't just about diet. It's the body signaling a deeper transition. At this stage, pushing large meals may not be effective. Instead, prioritizing comfort, easy-to-eat foods, and hydration can make a greater impact on quality of life. If your elderly loved one is losing significant weight, eating less, or feeling weaker, it's time to take notice. This isn't just about physical changes. It's the body sending an important message. Understanding this now allows you to prepare with compassion, clarity, and a focus on making every moment meaningful. 2. Extreme fatigue and weakness. One of the most striking changes in the final year of life is overwhelming fatigue that doesn't improve with rest. This isn't just normal tiredness. It's profound exhaustion that makes even simple tasks feel impossible. Getting out of bed becomes a struggle. Walking across a room takes effort. Everyday activities, like dressing, cooking, or even holding a conversation, become draining. This isn't just aging. It's the body conserving its limited energy. As organ function slows, the heart pumps less efficiently, circulation weakens, and muscles don't receive as much oxygen. This is why many elderly individuals in their final months feel weak, unsteady, and unable to keep up with their usual activities. Another factor is metabolic slowdown. The body, once focused on producing and using energy, begins to shift toward preservation. Instead of fueling movement, energy is redirected toward sustaining only the most essential functions. This leads to increased sleep, longer naps, and difficulty staying awake for long periods. Some may even experience sudden drops in energy, seeming fine one moment, but completely drained the next. Perhaps the most difficult part of this process is its emotional impact. Seniors who once valued their independence may feel frustrated or embarrassed by their limitations. They may withdraw from conversations, avoid social interactions, or stop participating in hobbies, not because they don't care, but because they simply don't have the energy. This can lead to isolation, which only accelerates their decline. For families, watching a loved one go from active and engaged to fatigued and withdrawn can be heartbreaking. It's easy to assume they just need to push through, but the truth is, forcing activity won't help. What's most important is recognizing their limits, allowing them to rest, and ensuring their remaining time is as comfortable as possible. If a loved one is experiencing persistent, unrelieved fatigue, it's a sign of a major transition. This is the time to cherish conversations, create peaceful moments, and offer support without expectations. In the end, it's not about what they can still do. It's about making sure they feel loved, understood, and at ease. If you're finding this video helpful, comment number 2 below to let me know you're here. And if you haven't subscribed yet, be sure to do so, and turn on notifications so you won't miss future content. Your support helps us continue providing valuable insights. Now let's move forward. 3. Increased cognitive confusion, or withdrawal. One of the most noticeable changes in the final stage of life is how a person thinks, communicates, and interacts. Someone who was once sharp and engaged may begin forgetting things more often, struggling to follow conversations, or appearing disoriented in familiar places. They might repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These cognitive changes can start months or even a year before passing. This isn't just ordinary forgetfulness. Like any organ, the brain relies on a steady flow of oxygen and nutrients. As circulation weakens and oxygen supply decreases, cognitive function declines. This can lead to confusion, difficulty making decisions, and trouble recognizing familiar faces or places. Some may even experience moments of clarity, followed by sudden disorientation, as if their mind is flickering in and out. Another common sign is emotional withdrawal. Many nearing the end of life lose interest in social interactions. They may speak less, engage less, or spend long periods in silence, not because they don't care, but because their brain no longer processes emotions and connections the same way. Conversations become exhausting, loud environments overwhelming, and eventually they retreat inward. You may also notice mood or behavioral changes. Some become irritable, anxious, or easily frustrated, while others appear unusually calm, detached, or indifferent to things they once valued. This isn't just a personality shift. It's often the brain adjusting to the body's decline. As cognitive function slows, expressing emotions becomes more difficult, and their reactions may seem out of character. For family members, this stage can be particularly challenging. Watching a loved one become disconnected from reality or withdraw emotionally can feel like losing them before they're truly gone. However, it's important to remember that this isn't something they can control. Instead of trying to pull them back into conversations, the best approach is to meet them where they are, speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If you notice increasing forgetfulness, confusion, or disengagement, don't dismiss it. These are often early signs that the body and mind are preparing for their final transition. This is a time for patience, cherishing quiet moments, and creating a familiar, peaceful environment. Even when words fade, love and comfort can still be felt. Frequent infections and slow healing. A clear physical sign that the body is winding down is a weakened immune system. Someone who rarely got sick may suddenly catch every cold or flu going around. Minor infections take longer to heal, and small wounds, like cuts or bruises, heal much more slowly. These aren't just random occurrences. They signal that the body's ability to repair and defend itself is declining. One major concern is recurring infections. Pneumonia, urinary tract infections, UTIs, skin infections, and oral infections become more common as immunity weakens. Many families assume these are isolated issues, but when illnesses happen frequently or take longer to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics may seem less effective, requiring stronger medications and longer recovery times. Another overlooked issue is chronic wounds. If small cuts, sores, or bruises take a long time to heal or keep reopening, it could indicate poor circulation. When blood flow slows, oxygen and nutrients don't reach tissues efficiently, making healing difficult. For those who are less mobile, pressure sores become a serious risk, potentially leading to dangerous infections if not properly managed. What's even more concerning is that infections in the final stage of life don't always present as expected. Instead of a high fever, an elderly person might simply seem more fatigued, confused, or disinterested in eating. In fact, a sudden decline in mental alertness is often the first warning sign of infection, even before physical symptoms appear. Recognizing these changes early can ensure your loved one receives the right care and comfort in their final stage of life. For families, watching a loved one battle recurring infections can be both frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping another round of antibiotics or another hospital stay will make a difference. But at some point, the focus often shifts from curing to providing comfort. Ensuring they stay hydrated, keeping their skin clean and moisturized, and reducing physical stress can do more for their well-being than treatments that may only prolong suffering. 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a shift in breathing patterns and circulation. You may notice slower, shallower breaths, occasional pauses, or an irregular rhythm where breathing speeds up and then slows down. Some individuals develop a pattern called Cheney-Stokes respiration, where deep, rapid breaths alternate with long pauses. These changes may start subtly, but become more noticeable over time. Circulation also weakens. Hands, feet, ears, and the nose may feel cold, and the skin can turn pale, bluish, or mottled, particularly around the fingers and toes. This happens because the body prioritizes blood flow to vital organs, reducing circulation to extremities, an indication that the heart is not pumping as efficiently. Shortness of breath may become more frequent, even with minimal movement. Simply sitting up, speaking, or shifting positions might leave them winded. They may breathe through their mouth more often, or struggle to catch their breath while talking. If they once walked across a room easily, but now struggle, it could indicate declining lung function. Fluid buildup in the lungs can also contribute to breathing difficulties, causing a persistent cough, gurgling sounds, or chest tightness. Many assume this is just congestion from a cold, but in elderly individuals nearing the end of life, it often signals weakening lungs. Lying flat may become uncomfortable, leading them to prefer sleeping propped up on pillows or in a recliner. For loved ones, witnessing these changes can be alarming. It's natural to want to help, encouraging them to take deeper breaths, or worrying that something urgent is happening. But in many cases, these shifts are simply the body's natural way of slowing down. While these physical changes may not always be reversible, there are ways to ease discomfort. Keeping the room cool, using a humidifier, or offering small sips of water can help. In some cases, medications or oxygen therapy may provide relief, but the priority shifts from fixing the issue to ensuring comfort. If you notice signs like irregular breathing, cold hands and feet, or a bluish tint to the skin, recognize that these indicate the body is conserving energy. This is a time to be present, offer reassurance, and create a peaceful space where your loved one feels safe and at ease. Looking back at what we've covered, significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation. These are common signs in the final year of life. They may not all happen at once, and they can be subtle at first. However, recognizing them allows you to prepare emotionally and practically for what lies ahead. For many families, it's difficult to accept these changes. The instinct is to fight against them, to encourage eating, movement, and activity. But sometimes, the best approach is to honor what the body is signaling. Instead of trying to reverse the inevitable, the focus should be on making their remaining time as peaceful and meaningful as possible. Understanding these signs isn't about fearing death. It's about being prepared. Recognizing them early allows for better care, thoughtful decisions, and a chance to fill their final months with love and dignity. This is a time to cherish moments, share memories, and ensure they know they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath. You are not alone in this journey. Many families have walked this path, and while it's never easy, knowledge can bring strength, patience, and peace. Thank you for being part of this discussion. We'd love to hear from you. Share something you've learned and how you plan to use it in your life. Your thoughts matter to us, and your support helps us continue creating content that informs and inspires. If you found this helpful, please like, subscribe, and share. We look forward to seeing you in the next video.